This video was brought to you by Hamilton Madison House, AAF, and ONA. Influenza vaccine. Influenza is a seasonal upper airway and lung infection that causes fever and a cough or sore throat. The flu happens year-round but is most common in the fall and the winter. Several children and families within New York are hospitalized or die due to the seasonal flu and pneumonia complications, which stems from the flu. Getting the influenza vaccine or flu shot is the best way to help protect you. Please keep in mind receiving the flu vaccine only protects you from the flu and not COVID-19. As the flu is spreading during COVID-19 pandemic, we're here to help you understand the difference between the two. The flu and COVID-19 are caused by different viruses, but may have similar symptoms. Both the flu and COVID-19 have several common symptoms such as fever or chills, cough, shortness of breath or difficulty breathing, fatigue, sore muscles, headache, and sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. Symptoms for both the flu and COVID-19 may appear shortly after exposure. It may take a person longer, however, to show symptoms of COVID-19, whereas symptoms for the flu may appear after 1 to 4 days after exposure. Some people may have COVID-19 and no symptoms, but with the flu, a person will have symptoms. The flu and COVID-19 spread in similar ways. Through close contact within about 6 feet with a person who is infected, through droplets sprayed when a person coughs, sneezes, sings, or talks, and touching a surface that has the virus on it, and then touching their mouth, nose, or eyes. Once again, people who have no symptoms can spread both the flu and COVID-19. This is why it is very important to frequently wash your hands with soap and water, in addition to disinfecting surfaces frequently touched by people in high traffic areas to avoid both viruses. Now, parents, this is the most important information. Children within the program have to receive all the immunization listed, especially the influenza vaccine, to keep them safe. Children under 5 years old are at higher risk of severe illness from the flu than COVID-19. This is a policy listed by the mayor in Article 47.25 of the DOHMH. It states that between July 1st and December 31st, all children ages 6 months to 59 months must receive 1 dose of flu vaccine if they attend daycare, Head Start, pre-K, or nursery schools. Children are no longer exempt from vaccination requirements due to religious beliefs, and the only children who are not required to vaccinate are those with medical exemptions. Due to COVID-19, New York City recently expanded the vaccine requirement for children enrolled in school and daycare. Even if your child had all their required vaccines last year, you should check if they need additional vaccines this year. Please contact your child's primary care doctor for more information. Remember, just because you get the flu shot, it does not mean it will protect you from COVID-19. However, by doing so, your child can continue to attend the program in a healthy and safe environment where they thrive socially, emotionally, and ready to learn.